Morning, Ban. My name is Camilo Gilabert. I'm treating physiotherapy today to my patient Tina Payne. Tina is a female, 37 years old, and comes to my clinic complaining of low back pain, right greater than the left. I don't have much information on her referral. I only have information regarding her medication. She's taking Nurofen, Panadol, and Panadol Forte, and the recommendations from the um, GP is that the physio it's to do physio for 8 weeks and then a follow up with the GP after this 8 weeks of physiotherapy. So because I don't have much information in my chart, I will be expecting a patient primarily with pain, but we don't know since when this pain started. So I would like to dig in what was the mechanism of injury, what is the data, what is the evolution of the pain, what was the onset and how was the onset, what is the palliation and provocation, what is if there is any radiation, what is the quality of the pain, the severity and the time involved. So I would like to know what are mainly the aggravating factors and relieving factors, what is the 24-hour pattern of pain, what are the symptoms and signs involved, and probably if there is any weakness or sensation impairment like pins and needles, numbness or shooting pain. Overall, I'm expecting a patient mainly with pain and also gait and movement biomechanics alterations with a reduction in the social life participation and the ADL's issues with ADL issues because to this low back pain. So to further assess my patient, I would like to bring with me my numeric rating pain scale, and yeah, that's it. Knock knock. I'm gonna wash my hands. Hello, Tina.
Good morning.
Morning, Tina. How are you?
I'm okay, thank you.
That's all right. My name is Camilo Gilabert. I'm the treating physiotherapist today. How are you?
I'm okay.
That's great. Do you mind if I have a seat here?
No, no.
Thank you. Um, Tina, as I told you, I'm the physio. I would like to make sure that I'm with the right patient. Can you please confirm your full name, date of birth, and age, please?
Yeah, so my name is Tina Page, and I'm 37 years old.
Okay. And your date of birth is? The
Blah, blah,
whatever
blah, blah,
of
blah.
the whatever of
Yeah.
the whatever.
Yeah.
Good. Thanks for sharing that with me, Tina. You can see here this is an exam situation for me. You will see my assessor X and Y. They will be assessing me. Is that all right for you?
Yep,
All good?
all good.
Great. Have you been in physio before, Tina?
Yes, I have. Yes,
All right.
I have. Yeah,
Let me
yeah,
just do a
twice.
quick brief summary of how my session is going to look like. It's going to be around 50 minutes, you and me. The first part is going to be me asking you tons of questions just to get to know you better. The second part will be hands-on assessment and we will be planning some goals together. And the third part will be doing some exercises. How does it sound to you? Sounds good? That's great. Thanks, Tina. I know you are 37 and you are complaining of low back pain. That's the only thing that I know.
Yeah.
Probably the GP was the one that was referring to me.
Yeah, yeah,
And
yeah.
he said do 8 weeks of physio and you are having Nurofen and Panadol. Is that correct?
Yeah, yeah, yeah. And then
Correct.
that didn't really help, and then I had to go to the emergency department.
All right, so
And
sorry to interrupt you, Tina. I would like to start building up all the history from the beginning. How everything started.
how everything started. Right, so I'm a I work physically, right? I'm a builder,
All right.
and I've got my own business,
All right.
and I was drilling.
Drilling.
Drilling,
Like heavy
yeah,
drilling.
yeah, heavy drilling.
All right.
And then, oh my God, it
You
was
felt like a
just,
pinch.
oh, it was shocking, honestly. It was more like a pinch. It was
it was on the left?
excruciating. No, 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 no. It was on the right.
On the right side.
Excruciating pain,
Alright.
like it's shocking. And yeah, and I thought I had to stop working.
All right. When did it happen?
5 weeks ago.
5 weeks ago.
5
All
weeks
right. So
ago.
everything started 5 weeks ago.
Yeah, yeah.
All
it
right.
was
So
5
you were
weeks.
drilling, and then you felt this shooting pain, like
Oh.
the worst pain ever. All right.
No, not, yeah. It was
Was a really
full
bad
on.
one.
I had to stop working. I
Alright.
could not.
So what did you do then?
Well, I went to the doctors. I
Alright.
stopped working.
Right
you
away?
know. Yeah. I
GP?
went to GP.
Alright.
Yeah. So and then he gave me some Panadol and some Nurofen, I think it was,
Alright.
and sent me home. And
Did it
then
work? The Nurofen? No. Alright, so what did you do? What did you do next?
Yeah, because it didn't get better. I went, so I went to the ED
Alright.
department, right? So because
When?
emergency.
Because
After 1 week after.
1 week after. So you were with
yeah.
pain, like not having any improvements, and then you decided to go to
and
college.
they said actually they gave me some stronger stuff, the
Mm-hmm.
I think Panadine Forte,
Alright.
with a codeine in it, which was great
Alright.
and helped a little bit. And then they sent me straight to the physio.
Alright, straight
So,
to the
yeah.
physio.
And I went to the physio and yeah.
Sorry to interrupt, Tina. Did they gave you any diagnostic, or it was just low back pain?
No, they didn't do any.
Did they took you any imaging, like an MRI or something like that?
No, they haven't done anything,
Alright.
so
Alright.
and then it's,
Alright.
because nobody knows really, it's low back pain.
Alright, so they just say low
low
back pain.
and then, they sent me off to the physio.
Alright. When you were in the emergency department, how was your pain? Was like localized in the low back, or was running to your glutes?
No, it was going into the buttock,
Buttock?
into the buttock a little bit, and then running down down in the thigh to the
Back
knee,
to the, back to the knee, and then did it come to the
No.
foot or leg or something?
No, not that, right? Just
Alright.
to the knee.
Alright, and was the pain constant? Like always
At
there?
that time, it was just, that freaked me out.
For
Really,
sure.
that's why, it was just,
Probably.
constant, but, still, it was there all the time.
It was
but,
there all the time,
It was there all
alright,
the time.
and probably there were quite a few movements that was aggravating your pain.
Yeah, I couldn't walk,
Alright, so
You
let's put things like, let's try to make things clear. So you were having pain the whole day, the whole time,
Yeah.
and if you could put a rating, like a number from 0, which is nothing, not pain at all, and 10 is the worst pain that you could ever imagine, how was your level, your baseline level of pain?
When I went to the ED, emergency, So 10 is the worst, you say?
10 is the worst.
It was 7, 8 out of 10.
So you were having 7 or even 8 out of 10 the whole time?
It was really bad.
Alright, and what sort of things aggravated your pain?
Aggravating makes it worse, you
makes
mean?
it worse?
Walking,
Alright.
the walking was, walking was...
Just giving few
just
steps?
normal walking,
Alright,
normal
and
walking was...
how bad was the pain when you were walking? How bad was the pain?
I had to stop walking, so what do you mean how was...
Number. What number would you say
When
was?
I walked, because I had to stop, it went up to, to 7, 8, that's why I had to stop, What helped me was stop walking, resting, and hot showers, right?
Mhm.
So that helped me, so that was,
And how? And what was the level of pain when you had this shower and you were resting? When you were resting, how was the pain?
Oh, that was,
number?
significantly lower.
Number?
So 1, 2, 3, maybe.
Alright, so 1 to 3 when you were resting, and then when you were walking, 7 to 8 out of 10.
It got
Easy.
really, that's
Easy.
after 5 minutes.
And
so.
the pain was always starting from the low back and running to the back of your knee.
Yeah. When I was walking, so
Alright.
I really.
And then they sent you to the physio. You did some physio sessions there.
Twice.
Two sessions.
Two sessions.
Alright.
Yeah.
Did you have any improvement on the physio session?
Initially, but then it all, she showed me some exercises, and then she did some sort of stuff there on my back. It was she, and but it didn't really help. So
Alright.
I'm really worried now that something bigger is going on there, because nobody, there was no. there was no X-ray done, nothing.
Alright, just to know, Tina, when did you stop doing physio? Because you were not having an improvement, or because you don't have
No, I
time?
didn't
Or...
stop. I only had 2 sessions, right? And then,
All right,
you
because
know,
you
got,
did everything happened like 4 weeks ago when you went to the emergency department, then they sent you to physio, and then you started physio straight away.
yeah, yeah.
All right, so
So
it
yeah, they're
has
fully
been.
booked.
All right,
Yeah,
so
so
you were
they-
not able. You
I'm
was
happy
not.
to do physio, but I'm not sure whether this is helping what they
For
do
sure.
there for me, right? I'm happy because I need to go back to.
So
I'm
the
a sole
other
trader, right?
the other physio that you were seeing was not having more spots available for you.
Yeah, that's
So
you
that's
know, I
why
only
you're
seen
here.
them twice. Yeah,
Okay,
yeah.
and
So
what-
I'm happy to, you know.
What sort of things were you doing on those physio sessions?
Yeah, you know, first one was lots of talking, you know,
Alright.
initial, you
Lot
know,
of
like you do
education.
you know to me, you know,
Uh-huh.
and then yes, so she did her assessment, you know, like to do all these things.
What exercises
You know?
you did
The
with her?
exercises. Do you do yoga?
Yeah.
Yeah, you know your happy baby pose. Do you
Mhm.
know that one?
Yeah.
Yeah, that's what she showed me, you know. And then I had to stand, and do you want me to show?
No.
To show
Just
you
tell
that?
me.
Yeah, I had to stand, and then I had to put my hands on my buttock, and then you know like leaning backwards.
All right. So like
You know,
doing
so-
bridges. Were you doing
No,
bridges?
it's standing. I was
Ah,
standing.
you were
I
standing.
standing.
Okay.
Yeah. So the first one was on the back, and then you know like you know like a frog. You open your
All right.
you know.
So it was more like
Maybe-
stretching exercises, range of motion exercises.
She explained it like both, you know. So because
Mm.
she said that somehow the nerve is pinched,
Okay.
you know. So that would explain the you know sort
The
of,
pain
the
running
pain.
down to your neck.
Yeah.
All
And
right.
I'm really worried now that it's initially it helped and I did them, but it's not.
Together with the pain, were you having any sort of weakness in the muscles?
No,
Or
that was all good.
pins
you know?
and needles, numbness?
No, I didn't have. Didn't she asked the same? I did
Was
not
just
have that.
this pain
Just
like
yeah.
was it
just
like
this
electrical
robbing,
pain?
You know, like robbing.
electrical
you know,
pain?
What is electrical
Electrical
pain?
is like you feel like actually like electricity
like a
running from
shooting
pain.
pain. Yeah, more shooting. It was
Alright.
shooting. Yeah.
You remember? Have you ever hit the tip of
The
your
funny
elbow?
bone.
The funny
Yeah,
bone?
yeah.
So it feels like you
Yeah.
actually feel like an electricity
Yeah.
there. Was something like
So
like the
here
same?
it was like dull and achy in the
Alright.
buttock thing, you know. So no,
Alright.
maybe it was more dull and achy.
All right.
You know,
So
like kinda
now, Tina, what sort of movements makes your pain worse now?
Walking.
Walking. Just walking?
The walking is the worst.
What about leaning forward? Does it aggravate or alleviate your pain?
I'm doing you know, if I've got a bit of a round back, then that helps me. You know,
Helps
if I straighten up, you know, then it's really yeah.
It's really bad when
It's
you
bad.
lean backwards.
And then lifting, you know, so the physio said not to lift more than 5 kilos.
All right. So just to make the things clear, Tina, bending forward alleviates your pain.
Just
Is that correct?
if I sit like
If,
that.
if you sit like that. All right.
yeah,
So
yeah.
every time that you try to straighten your back, it makes it worse.
Yeah,
So
so
that-
it doesn't feel really
Really nice.
really nice.
And you were
yeah.
doing those exercises with the previous physio?
Yeah,
And-
and that didn't help, didn't do
All
much,
right.
you know.
Easy. So basically, just trying to make things a little bit going a little bit forward. We probably will be doing exercises that alleviate your pain rather than aggravate your pain.
Yeah.
You know what I mean? So that's the first thing that I probably will be changing on my sessions and the home exercise
Just
program.
yeah, as long as it helps. The ones I did, you know, she gave me.
For sure.
That didn't really help.
Tina, yeah, so I already, what about twisting? Twisting is so bad.
Don't even go there.
For
You
sure.
know, so
Yeah, I
very
know.
stiff and
Okay.
no, I
No
don't. Honestly, I don't want to twist, right?
No worries. So,
No.
Tina, in your regarding to your social life, do you live in a single-story house, a double-story house?
Yes, no, we have single.
Steps
Yeah.
or ladders to get in and out
No,
of your house?
no steps. I've got 2 kids, eh?
All right. How old are your kids?
Young, 7 and 5.
Oh, I have
Yeah.
7 and 5 as well, so I know they
Ah,
demand a lot of you, for sure.
full
It's
on, eh? Yeah,
full
yeah. And
on,
if you're
full on,
working full time and then self-employed, you know what's,
for
you
sure.
know.
I know you are a builder and you're self-employed, so
Mm.
now you're on a leave. Obviously, you take your
No,
leave.
I do. I still work because I've got an apprentice,
Mm-hmm.
right? So he does all the lifting now for me.
All right.
Yeah. So because the physio, she said, not to lift more than 5 kilos.
All
So I
right.
delegate. I'm still at work.
All right. So you're still
Yeah.
working,
I
but you
still
probably.
work, but hard because builder, you know.
I know. And do you think you will be able to take 1 or 2 weeks off? Will be something that you could do or could consider to do? Because
Yeah, well, if I have to,
I
I
know
mean, in the
it's
longer term, so you
really
have
hard.
to.
It's really hard, Tina. I know because see, being self-employed, I am also has been self-employed.
I've got.
But just because at the end of the day, if we take 1 week or 2 weeks
Yeah,
now,
I've got insurance.
then
I've got insurance.
probably will in the long run will be better for you,
Yeah, I have to.
because we need to give some time to the body to heal.
Mm.
You know what I mean? So as long as we respect those time frames for the body to heal and give a sort of relief on those muscles and those joints and ligaments and stuff like that, we will be able to start from zero, like to reset everything on
Okay.
your low back, and then start building up from there.
Yeah,
You know what I mean? So
I would try to claim insurance. Can I claim this on insurance?
this is not my scope of practice, Tina, but I'm more than happy to refer you to the social worker,
Social worker. Oh, yeah. Okay.
the social worker, where they could come to you with all these sort of advices.
Yeah, maybe I should do that, eh?
All right.
Because I might need help with insurance claim there
For
because
sure.
it's not workers' compensation. It's a different one.
For sure. Anyway, I'm happy with that decision, Tina. This is something that I strongly advise on you to take probably 2 weeks. Let's see how one week goes, but probably 2 weeks will be way better, so we can, give time to the body to heal.
Okay.
All right.
Okay.
So, what are your hobbies, Tina? What things you enjoy to do apart from building?
I play footy in the
cool.
Women's League. Yeah.
Beautiful.
All right. And I went to. After I've been to the physio, last week I went to, I thought, I've got to get moving, so I went to the footy, and on the Saturday, so I played with my team, and,
You're still playing?
Yeah, because it was, as I say, initially it was getting a bit better, but then,
well, Tina, that's something that for sure, at least until I give you the clearance, you have to stop footing on the weekends, alright?
Because I paid the price on Monday, I was so stiff.
I'm pretty sure that was really good while you were playing, but after, or probably the day after, was nightmare. So for sure, that's something that we have to stop until we get you better. We get you, reduce the pain and improve your mobility, and then we can start thinking about getting back to the footing.
Okay.
Sounds good to you?
All right, yeah, okay.
All right.
Yeah.
Anything else that you want to add as your hobbies that I could be aware of?
No, my kids keep me busy, of
they
course.
They take like 90%
so you know what
of your
it's
day,
like,
for sure.
So.
All right. And what about? Do you live with your husband there, with your two kids?
Husband, 2 kids, and that's it.
Is he supportive with you, and are you coping well in the family dynamics?
Oh yeah.
Sure.
We've been
No
married for quite a while. But
all right. So no problems at all. You are having problems with your daily life activities, like getting rest or going to the shower or having.
No, shower is my favorite pastime now because that is really, that really helps me. That helps me, the heat.
Cool.
Long hot showers.
Have you tried cold? Put cold ice packs?
No, nobody ever advised me on that one.
No worries. Just just making
rest
questions.
and hot shower.
And what about, Tina, if you don't mind me asking, do you smoke?
No.
And what about alcohol intake?
Yes, I do, but not much. So
not much. How much would you say it is?
Maybe once a week with my, once a week.
Once
after the footy,
After the footy. All right. So keep that way. You're doing well, Tina.
Thank
Try
you.
to make it, on that amount. Not go higher because that's gonna be better for your rehab. All right.
Yeah, okay.
All right. So Tina, do you have any medical condition that I should be aware of? Do you take any other medications apart from Panadol and Nurofen?
No.
Any allergies? No?
No.
Okay, cool. And what are your expectations from today's session, Tina?
Yeah, I need to go back to work, So
Yeah.
from today's session, yeah, so maybe, we can alter the exercises a little bit or get something. Right now I'm okay, when I
Alright.
got here, yeah.
Okay,
pain
means
is
like
not
a one
too-
or two?
1 or 2, yes.
Alright.
Yeah. So, and then I can walk again without
Pain.
pain, So
Alright.
because this is what really, so that it's,
For sure.
I cannot just have hot showers and resting all day, right?
Yes, I'm pretty sure. So Tina,
and I need to go back to work. long-term.
walking without pain and being able to get back to your job will be
Mhm.
something like probably a long-term thing. Long-term
Okay.
meaning like after a week or two, you will starting to
Okay,
feel
not months.
much more relief.
Okay.
And then after that, we have to start building up on your core strength, your back muscles and stuff like that. And then
Okay.
you will be able to start building up your liftings and getting slowly back to your job.
Yeah.
Makes
I
sense to
tried
you?
lifting, so just little, less than 5 kilos.
Alright. I'm going to show you how to do it because
Okay.
you have kids and you probably can't stop doing the household
yeah,
things.
exactly.
But I'm gonna show you the right way to do it so you don't hurt yourself or don't injure more yourself. Make sense to you?
Okay.
That's the first thing. The second thing is, we need to start from the bottom, and that means start to reduce your pain. But the walking without pain is not gonna happen just today. It's not gonna happen today.
I understand
so,
that.
Is there anything that you would like to add, like for today's session?
What I want to see for
Yeah,
today?
just today.
Maybe, right now I'm okay. Maybe you can give me another exercise or
Alright, so
something like that.
work
What
on
I
your
can
exercises.
do, because they
Please.
didn't. I've done them, but they didn't do much.
No worries. So certainly we are gonna work on that, Tina.
Mm.
And I'm gonna ask you a few questions. You just tell me yes or no, alright? And just to rule out a few red flags that will indicate. Will tell me if I need to request like a few more tests or things like that. Alright?
Yeah. Okay.
So, have you ever experienced like headaches or
No.
any unremitting pain in any side of your body
No.
apart from the low back pain? Any problems with your vision or hearing, tasting, swallowing? No. Any problems coughing?
No.
All right. What about chest pain?
No.
Night sweats or chills or fever?
No.
No. Problems with your bladder or bowel? No problems at all. Any sudden weakness in any side of your body? Any sensation impairment in any side of your body? All right. Anything that you would like to? Do you think it's important to tell me about your overall health or your history?
No.
Anything that you would like to add?
No, not
No?
really. Just
Great.
right now.
Great, Tina. So now we are going to jump on our hands-on assessment. All right?
Yep. Okay.
Cool. So probably you don't have problems with your upper limbs. Can you move them freely without pain?
You want me to move them
Yeah,
now?
sure.
Yep.
Sides, no problems at all?
No.
Beautiful. So, because you're sitting there, when we go to the plinth, I will let you have a look to your low back muscles. But now, I just want to make sure you don't have any strength impairments. All right? So
Okay.
first thing, I want to see how is your sensation here. Okay? Do you mind if I put my hands on your thighs? All right. As it feels, do you feel this? And does it feel the
Yes.
same on both sides?
Yes.
All right. What about here?
Not all the same.
Here,
Same.
here,
Same.
here,
Same.
and here.
Same.
Tickles? For sure. So close your eyes, please, and let me know if your toe is up or down.
Up. Down. Up. Down. Up. Down. Up.
Sensation and proprioception are checked, no issues at all.
Okay.
Alright? So put your knee up towards the ceiling for me. Up, up, up. Leave it there. Up. Don't let me push you down. Good job. Kick out for me. Don't let me push you down. Pull my hand. Good job. Toes up. Don't let me push you. And pull my hand. Push my hand, sorry. Good job. Same with this. Knee up. Don't let me push you down. Good job. Extend your knee, please. Any pain?
Mm-mm.
No? Alright. Don't let me push you down. Good job. Now. Pull my hand. Good job. Toes up. Push my hand.
No.
Beautiful. Really
I
strong.
never felt weak, just a stiffness. You
Just
know,
a stiffness.
Stiffness and pain.
So what I'm thinking, just based on what you have told me, looks like a facet joint problem, more like rather than a disc problem. All right.
Oh, okay. Oh, right. Okay.
So because the spine works like that, you will see the vertebral bodies are made of bone, and in between each vertebral body, there is a disc in between of all
Yep,
of them.
yep,
That is
yep,
like
yep,
a
yep.
springy,
Yeah.
that looks like a donut.
Okay. Yeah.
Alright?
Yeah. I've seen that one before. Yeah.
For sure. So probably what I'm thinking is because bending forwards relieves your pain, it's not involving like it's not a disc problem. It's rather than the joints that connects one vertebral body with the other one. There is a joint. I'm gonna send you the photos anyway. So
Yeah.
there is a joint that every time that you bend forward, you separate those joints, and when you bend backwards, those facet joints stays closer, sticks together. So
okay.
that's why it hurts.
Ah.
You know,
Okay,
so
yeah,
when any time that you got pain in your facet joints in your spine anywhere, your muscle starts to get spastics. You know, it's not spastic. You have muscle spasm.
Yeah.
And also you will feel really tight, really short of the muscles, shortening of the
Yeah.
muscles.
Stiff.
You know what I mean?
Yeah,
Really
yeah,
stiff.
Yeah.
So all the muscles try to work together just to not let the spine to move,
to protect. Yeah.
for
Yeah.
sure.
Yeah.
All right.
Okay.
So that's what the first thing that we need to do is try to release those muscles.
But how can it radiate down? You know, I
Because
thought
when-
I've got sciatica or something really bad.
Looks
you know,
like-
because it's
looks like-
you know.
Because
And
there
this-
is a lot of inflammation, local inflammation in those in that area. That inflammation and the muscles that are with muscle spasm, and there is a space where the roots came out from the spine, and when the muscle starts to get tight, that space is reduced a little bit, and because of that, when the nerves comes out, it get caught.
Ah, okay, by the muscle.
Yeah.
Yeah. Okay.
Muscle, local
okay.
inflammation. So basically what we need to do now is start moving within the pain limits, stretching, doing some massage, and this is gonna be like the first part, all right?
Okay.
Getting some movement on that area, and also working on the muscle strength on your core muscles,
Okay.
all right? But that's something that I need to double check as
Okay.
soon as I finish my my assessment. All
Okay.
right.
Mm-hmm.
So, can you show me how do you stand up from that chair? For sure, you're getting away of your pain. I'm pretty sure. So, what about if we put some load on that leg? Feels really bad.
I'm a
Yeah.
bit apprehensive to
For
do that
sure.
right now. It's okay.
It's all right.
Yeah, but if I walk, I know it will start, right?
For sure. So, can you please march on the spot for me, please? Just to know how are you doing. All right. What about the pain?
Yeah, it's okay. You
Let's
know,
talk in
so-
numbers.
Okay. Well, 2 to 3,
Easy.
something
I'm
like
happy
that.
with this.
Yeah.
So, Put your feet together, please. All right, and keep that posture. Great. All right, try to keep the line, the midline. I know you're trying to get away from the pain, but let's try to keep the midline.
It's habit now, right?
I know.
You know, so because
That's why I'm here, just to remind
Okay.
you to keep the line, because this is something that is gonna
this is almost
resolve.
normal for me now.
Yeah,
you know,
for sure. So let's try to do 2 steps to the left, 2 steps, 1 and 2, and then to the right, 2, 1 and 2. Good job. I know this is going to probably be hard, but I want to see how are you walking. All right? Yeah, let's just walk. All right. Come back for me, please. All right. Okay, so basically, you want to have a seat? All right, so basically what I have seen is a few gait impairments that we are needing to address. All right, that's the first thing. And the second thing is that I know this is really painful for you and you are trying to get away of your pain, but every time that you are standing up, try to make it in the midline rather than trying to stay away from the pain.
Okay,
all right?
maybe I should get a mirror or something.
Yeah, probably that's
you
something
know,
that we can work on.
Yeah.
For sure, there is a therapy based on mirrors. But today we're going to work more on your range of motion, getting back movement on that segment of the spine, and start building up the exercises for strengthening. All right?
Okay.
All right. So standing up, try to make it always in the midline, like so. All right? Hold on the armchair and stand up from there. All right?
Like here?
Yeah.
Like this?
1, 2, 3, and stand up. All right. Go back and try to make it one more time, but pay attention on your midline.
Okay.
Not getting away.
Yeah, all right.
All right?
Better?
Way better.
Better? Yeah.
Way better. So, the second part is we are going to address your gait pattern. So, first thing that I want you to do is with your right leg, try to land on your heel, and then your other leg step through. All right? All right, I'm next to you, so you're not gonna fall. All right?
Oh, easy. Didn't I do that?
Just a little shorter. You were having shorter steps with the right.
Oh, okay.
So try to make it a little bit longer. I know it's gonna be painful, but as far as we don't go over a 5 or 6 out of 10 of pain, that's fine.
Okay.
Movement and activities will be painful probably at this stage, but we don't want to overexert the pain. Don't want to go over 5 or 6 out of 10.
Yeah. Okay.
All the exercises, keep in mind, not go over 5 or 6 out of 10.
Okay.
All right? Anything. If any activity is taking you over 5 or 6 out of 10, step back.
Okay.
All right? And let me know.
Okay.
All right? So keep walking and go to the plinth, please.
This one?
Yep.
Okay. So how do you want me?
I want you facing up.
Facing up?
Yep.
Okay.
Laying down, facing up. I'm gonna put this for you.
Thank you.
Sorry.
Ah.
Feels good?
Oh.
For sure. So it's your right leg that is troubling you.
Yep.
Yeah. So let me yeah. So
Right now I'm good, you know?
beautiful. That's
Walking is
the main issue. But you didn't have any problems while you were walking with me, do you?
No, just after it starts after 5 minutes. You know,
After 5 minutes.
You know, like short
Yeah.
short distances. I'm okay.
Yeah.
You know, a bit
But after
apprehensive.
5 minutes, it starts the pain. All right.
Yeah.
Good to keep that in mind. So can you please lift your left leg straight for me? Straight. Good. No problems at all. Make the same, but slower with the right one. And let me know if you feel any pain, like in the back of your leg.
Yeah, it's starting now.
All right. Keep it there. Keep it there.
Yeah.
All right.
Oh, it's starting. You know,
All
it's
right.
starting. I can feel its
Is
tension
that pain?
there.
Is that pain?
Is that the
Is
pain?
that the pain? Or is more like you feel like tight?
No,
tight?
it's on the here in the
All
back.
right.
Yeah.
So release a little bit,
Yeah.
and then is this aggravating your pain a little bit probably?
Yeah, it's yeah.
Yeah. Good. Let's try to do some glides there. So, can you bend your head forward for me? And then bend backwards for me. Forward, backwards, forward and backwards, forward and backwards. Pay attention to the feet, what I'm doing with your feet. Every time that you bend backwards, your feet goes up, and every time
do that?
you can do that at home. This is gonna be your first exercise at home.
Okay.
It's called nerve glides.
Yeah,
All right?
yeah.
So basically what we are going to do is raise your leg until you feel the pain running back.
Yep, okay.
And then you're going to bend backward your head, and your feet is gonna go up.
Okay.
And then you're going to bend forward, and your feet is gonna go that way.
Okay, so let me have a look.
Yep.
Without doing it right.
10 times. Slowly, slowly. We don't
Like
want to.
that?
Yeah, we don't want to go over 5 out of 10 of pain. All right?
Okay. Jeez, it's good for the tummy too.
For
isn't
sure.
it?
That's the main muscle that we're going to start strengthening. All right, the tummy muscles, or what is it called, the transversus abdominis.
Yeah, the other physio said something like
Yeah,
that.
for sure. That's the muscle that we want to target with the exercise.
Oh.
All right?
Yeah.
How do you feel?
Good.
Good? All right. So bend your knees for me, please. All right, bend your knees. And yeah, I just want to do exercises that alleviate your pain, and because you told me that bending forward or flexing forward your spine was relieving for you, I want to do the second exercises that you're going to do at home, and it's going to be bring your knees up and down.
Okay.
Up and down. All right,
Yeah.
10 times for me. Up and down. Up and down.
The other physio, do you want me to show you what the other physio did? It's similar.
Probably.
You know, I had to do this baby thing, right? Oh,
All
sorry,
right.
you know.
Yes.
This one.
All right.
This one. Didn't help though. And now you make me do this, okay?
What do you feel relief? Bringing your knees.
Yeah, it does.
Alright.
And that because I do understand, you know, you stretch the muscles and
Yeah.
as
So
I said, I
basically-
did this, you know, but yeah, anyway, I will give it a go.
All right. I know this is something probably similar.
Yeah.
The early stage will, I don't know, it's probably will look similar, just with a few changes.
Okay.
All right.
Yeah, okay.
But probably you will find that
I will
it's
try.
pretty similar. Okay.
Yeah. Okay.
But
So
it's
10 times.
gonna take like a week or 2 weeks until we get reduce the inflammation there.
Okay. Yeah.
Alright?
Okay.
All right.
Okay.
So this is gonna be the first exercise. The second exercise that I want you to do is after this.
Yeah.
The one that I just told you. Just hold your knees there and try to stretch your back muscles.
Yeah.
Hold
The
it.
same like
30
but
seconds.
Just with
Yeah.
the.
Yeah. Hold it there.
Okay.
All right. 30 seconds. 2 times 30 seconds. We're going to do just once,
Yeah,
but I want
yeah,
you to
yeah.
do 2 times at home.
Yeah.
You don't need to remember anything. I will write them down for you.
Okay.
All right.
Okay. So basically, it's a.
30 seconds
you know,
hold.
Yeah, and it's not like what the other physio showed me. that
But
we
I
are
want
going
to make sure,
Like
Tina, that
maybe
you.
this, like this.
Yeah, it's fine. But I want to make sure this is relieving your pain. You're
Yeah,
feeling
yeah,
like
yeah.
nice. You know. You will know, and you will tell me if this is relieving or
it
it's
feels
or feels
good.
weird.
No, it feels good, but
Alright.
it didn't. As I said, with the other physio, didn't help.
All right.
You know, it's basically yeah.
No worries.
Anyway, sorry, I'll give it a go.
Sure. So that's the second exercise. The third one
What was
It's
the
gonna
first
be
one? Yeah,
the
okay.
first one. You remember was walking, as I told you.
Oh, and then this one here.
Yeah,
This
sorry,
one,
that was
yeah.
the first one.
Yeah, okay.
The second one
Yeah.
is the bringing his
Yep.
knees up and
This
down,
up and down,
and the
10
third
times.
one stretching.
Okay, just holding.
That's the
Okay,
third.
gotcha.
All right. And the fourth exercise is gonna be doing some twisting. 37.
You sure?
What
Yeah,
I'm
yeah,
sure,
yeah.
right?
With it, you know, when I twist, but it's different now from the.
Now probably will be
Yeah?
different,
Okay.
but
Yeah,
we
no,
are going
it's
to
okay.
go as far as the pain allows us. Not go over 5. Not
Okay.
overstretch. Make sense?
Okay.
That side and make it slowly.
Okay. Yeah, all right.
How is the pain now?
No, it's good. It's good. It's
All right.
good.
You can even bend a little bit forward your knees and make
Yeah.
that way. Yeah.
Yeah.
So
it
what are
feels
we
good.
basically doing now is because your spine is like, how can I explain this to you? It's like a series of bones,
Yeah.
you know, getting that are together bonded by small pieces. And what we are trying to do is getting some movement on that segment.
Okay, gotcha.
All right?
Yeah, makes sense.
Movement like that. So
Yeah.
with the movement, what is going to happen is that we are going to start reducing the pain.
Okay.
All right? And I want you to keep doing your hot showers because that relieves your pain as well.
Yeah.
All right? Get your hot showers
Thank
as much
you.
as you can.
Yeah.
10 times
Heat
to the
pack,
right.
Heat pack. Heat pack. Can I put a heat pack on?
Max, if
Yeah.
it works for you, to
Yeah,
heat,
like a warm hot.
Go
water
on
bottle.
that.
Hot, warm, hot
for
water.
sure.
And I've got some physio cream as well. You know this and the purple.
Let's
Yeah.
try just with the heat at
Just
the moment. And you
normal
can bring the
water.
cream the next session and we can have a look to that.
Yeah.
All right. So what does it contain, and if it's safe for you, maybe if there is any medication that we can ask your GP as well.
No, it's not medication.
Bring it on the next session, all right?
Yeah.
And we can have a look at
Warming,
it.
you know.
So the fourth exercise,
Okay.
10.
Yeah.
All right, 10 times. Remember, pain guided.
Yeah. Okay. No,
Okay.
no, it feels good. It feels, I was because with the twisting, you know, like, but
Okay.
this feels good. This feels
All
good.
right, not a problem. So, can you face down for me, please?
Face down. So
Yeah.
turn around on the
Yeah, turn around and face down. Are you able to do that?
I have to, don't I?
Oh, you are 37, Stina. You're a builder.
Yeah. Well, if you've got that pain in the
Well,
back,
for
you
sure.
know, I tell you.
I wouldn't be so happy. All right, can I have a look to your back, your low back?
Yeah, of course.
Yeah.
Yeah.
Let me see. All right. So probably you will find a lot of muscle spasm here, and a lot of pain here, especially on the right side.
Yeah.
All right.
that
So
is-
what are we
yes,
gonna do
yes.
now is doing some soft tissue release
Oh.
on your low back pain.
Keep going.
Yeah, that should feel really good.
Do a little bit on the left, please.
On the left as well, just to make sure you are even.
Yeah.
All right. So yeah, trying to do some soft tissue release
Yeah.
there in the low back
Oh.
because these muscles will pull your spine.
Yeah.
And yeah, because I have been working so hard these 5 weeks that you will do this exercise at home. Maybe your husband even can help you with
Yeah,
this.
okay, so I will remember what you did.
Yeah,
Yes.
just doing circles
Okay.
and then up and down and then side to side.
Okay.
Super easy. Circles, up and down,
Yeah,
and then
yeah,
side to
yeah,
side.
Yeah, that's what
Alright?
the physio did.
At least 2 to 5 minutes.
Okay.
All right. All right. So I'm gonna show you the next thing that I'm going to show you is going to be how are you gonna lift things from the floor
Okay.
and some biomechanics. All right. Some good postures. Make sense?
Yeah, okay, yeah.
You have any questions for me so far?
No.
All right. How are you feeling your pain now?
Yeah, it's okay, you
It's
know,
alright?
it feels really nice, eh?
All right.
Very nice.
Well, let's say that we have been here for 2 minutes.
Just do it on the left.
Because really my pain is on the left. As a real patient, my pen is on the left.
Yeah, that's right.
Alright. Alright, Tina. Let's get back to the floor. Let's say that we have been here 2 minutes. Alright.
On the floor? So you
Yeah,
want me to lay on the floor?
No, sorry, where's my bag? Just stand up from there.
Oh yeah, it's
All
a bit
right.
better.
Bit better?
Yes.
Let's go to the chair. Alright, while you are sitting there, if you can remove your jumper will be great. I want you to feel your muscles, your belly muscles.
Yeah.
Alright, so where the six pack should be, my six pack should be
Yep.
just on the side of the six pack. You will find like a hole
Yep. Yep.
that will get you like right in the deep of your belly.
Yep.
And as soon as you cough, you will find like a muscle wall.
Yep. 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 Yep.
Alright, are you feeling that?
Yep.
Let me see how are you doing. Cough. Alright. Keep your hand there.
Oh.
Alright, cough. Strong for me, please. There you are. So that's the muscle, the transverse abdominis muscle.
Yeah.
That is the one that we want to target.
Okay.
Alright? One more time. Alright, so now you can probably, sorry, I have to go really deep. I know this is probably gonna be a bit painful.
Bruce.
I don't want to go onto your spine from here. I don't want to touch your spine, but has to be really deep. Sorry for that.
Okay.
So try again. Alright, now try to activate it without coughing. Just release. Activate it. Release. Alright, activate it and release. Alright?
Okay. Did I do? Yeah.
You're gonna get there.
How do I activate it?
Let's pretend that you are in the toilet and you are doing your number 2, or you are
okay,
coughing,
pushing.
pushing.
Okay. Now I got you. Okay.
You got me?
Yeah.
So that's the first thing. I want you to practice this at home. All right. Every time
Yeah.
that you are, laying down.
Another one. Okay.
This is just a practice thing
Okay. Okay.
during the day.
Yeah. Okay.
All right. It's not gonna be an exercise program. It's gonna be just so you are aware of how to target, how to activate this muscle.
Okay.
All right. So the
Okay.
next session will
Is
be
it
easier
weak?
for you.
Is it weak?
It is weak, and this is the main muscle that we need to work on to get stronger and to get more stabilization on your low back, on your
Okay.
spine, basically.
Okay.
All right.
So what about?
So, but you're doing really well now.
Yeah.
Activate that muscle.
Mm.
All right. Keep it activated and stand up from the chair. Activate and stand up.
Yeah.
And
Yeah.
stand down. Sorry. Sit down. Sorry.
Okay. Yep. Yep. Yep.
All right, and then you release. Make sense to you? So
Yeah.
what are we gonna do now is activate, stand up, sit down, and release.
Okay.
All right?
Okay. Better?
All right?
Yeah.
Way better. So I want you to do that 10 times.
10 times.
Yeah, 10 times. Good. 1. 2. 3. 4. Since you're a builder, Tina, this is something
I know.
that
It's okay.
we
It's
are
okay.
going
It's
to
good.
add to your home exercise program in the future sessions.
Good. Will do me
Alright.
good.
Because you will be lifting lots of things, blocks and pace and stuff.
That's right. That's right. So and every time, what you're saying is when I lift for the future, when I lift, I have to be aware of.
I'm gonna let you know right straight away as soon as you finish that.
Okay.
I'm gonna,
So where are we? 8.
8 and 9
Okay.
and 10. All right. Easy.
Okay.
All right. Any pain at all?
No.
That's
It's
great.
okay.
So stand up from me. Remember, activate and stand up. All right. So every time that you are going to pick up something, let's say your kid, let's say a bag, let's say whatever you want to pick from the floor, activate your muscle.
Okay.
Activate. The
Yeah,
abdominal.
okay,
All right.
okay,
Abdominal muscle strong, nice and tight. Bend your knees. Keep your spine really straight. Pick up something. Pick up your kid. Pick up the bag. Pick up whatever. And then with the legs, you're gonna lift that up.
Okay, because I always did it. Can I show you? You
I know how you did.
know,
Everybody
okay.
did the same. So you don't need to show me,
Okay.
but I'm gonna show you how you are going to start doing your
All
kicking.
right.
All right. Now, bend your knees. Get down.
Can't.
Yeah.
Oh, okay.
All right, and then stand up.
All right.
Let's go somewhere. Let's go somewhere.
And I hold it close to
holding
my
the thing
close to my body.
Always to
Okay.
your body, close to your body. Let's go and drop it off. Drop that off.
Yeah.
All
okay.
right, stand up again. And then now you release that muscle. Because that muscle has to be nice and tight the whole time.
Okay. Okay.
Let's practice this one more time. All right?
All right.
Nice and tight.
Yep. Yep.
Pick up something.
So I have to. Yep.
Lift it up.
Do not hold. Yep. Close to my body.
Holding, close to your body. Let's go. Drop it off. Stand up again.
Yep.
And then release.
Okay. Okay.
All right?
I shall not hold my breath.
You shouldn't
You know?
hold your breast. All right? So
Okay.
keep yourself breathing nice
Yeah, I
and
have to
strong. So
practice this. This is what the physicist didn't show me. This is what I need.
All right, so this
You know?
is gonna come with time. It takes some time to control these muscles and being able to isolate that muscles and being able to activate it without having to hold your breath
Okay.
or keeping you breathing. That's what we want. We want you to keep breathing.
Okay. Yeah.
All right?
Yeah. Okay.
All right. So, last thing that I want to see is how are you walking now? So can you show me please how are you walking now? All right.
It feels good.
Feels
Much
good?
better. Yeah.
All right.
I feel
Have a
after
seat,
you've
please.
done all this manipulation here.
All right. Have a seat there. So how would you say your pain is now?
It wasn't bad in the beginning. It's but maybe it's a 1 out of 10 now.
1 out of 10.
You know?
Cool. So you already have your exercise program. You have your routine for home. And your gait is way better than before. So we are going to keep on that track.
Yep.
If you can take 2 weeks off, that's great. I am going to send this referral for your social worker to engage with you, so he can advise you on that end. All right. Any questions for me?
So I've got 4 exercises, and then I
Yeah.
have to practice this. How much is okay? So when can I go back? 2 weeks, okay? And still for only 5 kilos, you know.
If it's better if it's
No
nothing.
footy playing. No
It's better
footy.
no footy at
So
all.
okay, so I need to take okay.
Yeah.
All right.
But it's better if you don't lift anything for these 2 weeks.
Yeah. Okay.
If you have to,
Yeah.
let's
Okay.
make it not greater than
Not
5
that
kilograms.
right.
So
and
not
how
a kilo.
much? And how much overall would you recommend to lift at all? You know.
Probably
for-
nothing at the beginning.
Yeah, but will I, because I have to lift up to 25 kilos.
Oh,
will
for
I
sure.
get so that's still okay? Yeah. Or-
That's still okay, but not at this stage.
Yeah,
We
I
are
do
going to start
understand.
slowly building up on that.
Okay.
Wait,
All right. Got
all
you.
right?
Yeah.
And today is Sunday, so I would like to see you again on Wednesday.
Yeah.
Okay?
Okay.
Easy.
Thank you.
Thanks for everything, Tina.
Thank you.